We are following breaking news. The CDC has just issued new guidance for all people to wear masks indoors in areas of the country with substantial or high transmission rates of the coronavirus. The agency announced the reversal this afternoon because of the rise in breakthrough cases with the Delta variant. This change also includes kids from K through 12. CDC Director Rochelle Walensky went into great detail about this change regarding schools.
In areas with substantial and high transmission, CDC recommends fully vaccinated people wear masks in public indoor settings to help prevent the spread of the Delta variant and protect others. This includes schools. CDC recommends that everyone in K-12 schools wear a mask indoors, including teachers, staff, students, and visitors, regardless of vaccination status. Children should return to full-time in-person learning in the fall with proper prevention strategies in place. Finally, CDC recommends community leaders encourage vaccination and universal masking to prevent further outbreaks in areas of substantial and high transmission. With the Delta variant, vaccinating more Americans now is more urgent than ever. The highest spread of cases and severe outcomes is happening in places with low vaccination rates and among unvaccinated people. This moment, and most importantly, the associated illness, suffering, and death could have been avoided with higher vaccination coverage in this country.
Joining me now is Dr. Teresa Murray-Amato. She is the chair of emergency medicine at Long Island Jewish Forest Hills. Dr. Murray-Amato, thank you for joining us. So the Delta variant is obviously a more contagious strain than the original. Are we seeing that these new infections are panning out in higher death rates as well, or are we not quite there yet?
So we know that the Delta variant is now here to stay. It's in the U.S. The majority of new cases are the Delta variant. Right now, it's hard to say. We know it's more transmissible, but we're not sure yet if it is actually more deadly. It's really a shame. I'm really seeing mostly every patient that I have to admit right now with COVID has not been vaccinated. So there is some reassurance that the vaccine right now is pretty effective against this variant. That's our hope.
And so is this updated guidance from the CDC that we are getting on mask wearing, do you think that this will be sufficient to help stem the surge of Delta variant infections?
Yeah, so it's incredibly disappointing to have to revisit the guidelines of wearing masks. I think when the vaccines first came out, there was so much enthusiasm for people getting vaccinated. It really felt like we were at that light at the end of the tunnel, and we were ready to really kind of move on and put COVID behind us. Unfortunately, what we have seen is the mass vaccinations have stalled, and we have, a large group of people who are, for whatever reason, hesitant or are not wanting or willing to get the vaccine. And unfortunately, that puts a lot of people at risk, including fully vaccinated patients. I have had a couple of my personal experience. A couple of folks who, for whatever reason, are on immune suppression medications who unfortunately weren't able to mount a good enough defense against COVID with the vaccine, and unfortunately did get the COVID virus. So really, when we start thinking about the transmission, it's still possible if you're fully vaccinated to get COVID, although it's very rare and very rare to get sick enough to be admitted. But there's still a chance. And so right now, what we're faced with is we don't have herd immunity due to vaccines. So we're going to have to start revisiting, what our behaviors are. And we knew in the past that wearing the mask indoors definitely helped decrease the transmission. It's just really unfortunate that we're back to this is the guidelines due to the decreased number of vaccines that people are getting.
Yeah, it's so disappointing to sort of be at this place right now when we had made so much headway. Getting people vaccinated and bringing down the infection rate. And then we have the double whammy of the rising Delta and not enough people getting vaccinated. I wonder, though, whether as a doctor you're concerned that people may just be tired of masks and worrying about socially distancing themselves, especially, those who are vaccinated. and may not take this new guidance to heart as they should?
Yeah, again, I don't blame people for being fully exhausted because of the COVID virus. It has been a long 18 months that we've been dealing with this, and unfortunately, it looks like we may be dealing with it for a bit longer. What I would say, though, is that for those folks out there that are considering getting vaccinated, maybe this new Delta strain will be the nidus to get you to go speak to your doctor and consider getting the vaccine. It's not too late. It's nothing more heartbreaking than having a sick patient or critically ill patient in the emergency department with COVID who says, I wish I'd gotten the vaccine, I was just too afraid. It's heartbreaking because that person didn't need to be in that position. So I really do encourage everybody, please, with this Delta virus variant coming out, take the time to go speak to your doctor, get the facts. The vaccines are safe, they're effective. But for right now, we're going to have to consider putting masks back on indoors, especially we don't have enough of the population vaccinated.
So, as you know, the new school year is right around the corner. There's a lot of unknowns for many students. Some schools are, like, for instance, my son's school is requiring everyone who's eligible to be vaccinated. But of course, there's still the question over whether masks will be mandated indoors or not. That hasn't been answered yet in a lot of schools. And while this new change is specifically for high viral transmission areas, should we expect more changes in mask guidance or other types of health guidance, considering that children under the age of 12 can't yet be vaccinated?
So far, COVID has given us lots of opportunities to learn about it and then make changes as needed. So I don't anticipate the fall being any different than what we've been going through, where we're going to have to see where we're at as far as vaccinations go and to see what percentage of tests are coming back positive. I'm going to say I think most school districts are going to probably err on the side of caution and consider having all the students and the teachers and everyone who works in the building being masked, especially just as the fall starts, since we don't quite know where this is going to go. It is very frustrating, but I think at this point we have to really think about keeping our teachers and our students safe. We're hoping that the vaccine will start to roll out for children under 12. We were hoping by the fall we'll have to see how the studies go. But that could be a game changer if we could start vaccinating the younger children as well.
All right. Well, Dr. Teresa Murray-Amato, thank you so much for joining us. We appreciate it.
Thank you so much.